So as a rheumatologist, we care for patients who live with chronic diseases and patients with fibromyalgia, which is also a non-inflammatory but a long-term condition that we often seek your help with to help them to live well with these diseases, right? So beyond being a counseling psychologist, you're also trained in art therapy. Yeah. So one thing I would, and I'm sure all our patients want to understand as well, is how would you say that art therapy is different from using art as a hobby to wind down?
So to begin with, what you are asking, I think that is where we try to understand using art as hobby as well as using art as psychotherapy.
Correct.
So using art as hobby also helps to relax. It also helps in calming one's mood, or it brings in good mood, it creates positivity, and then it helps to ground. But at the same time, using art as psychotherapy, this is a part of treatment program. So through this, for example, a person comes with lot of venting. So she's crying, she's trying to verbalize and keeps on focusing only on the pain. So in that aspect, in that situation, maybe if we try and give her one art material and ask her to create spontaneous art by telling, just create whatever is coming to you right now. So this helps her, even scribbling for that matter. And art therapy need not require any form of training. You don't have to be a good artist, or you don't have to have any creative way, because there is no right or wrong. So it is only understanding what that artwork means for an individual. So this, by creating this, that helps the patient to come back to the present moment and get in touch with internally. Because art therapy helps to access the hidden subconscious parts of self that is, it is very difficult to verbalize, and also it helps us to understand what is going on with the patient. But at the same time, we are not going to analyze the art. It is, we are asking the question to the patient, wherein they tell what it means for them.
So do you give a specific set of instructions to these patients to do a particular kind of art, or is it just what they want to do? Is it like a free form, or is it some or do you use any other stuff like clay or crayon or paint? Is there any difference in each of this, or?
Yes, definitely. It depends on the intention. So for example, some sessions can be structured sessions, some sessions can be unstructured sessions. For example, if it is a planned one, and if the client wants to work on the trauma, so if they are very much struggling with grief, so using charcoal can help. So each material has its own therapeutic value. So for example, clay, I think the way they the temperature of the clay, the way they mold the clay, how they hold it, and then the kinesthetic movement that involves, because it brings in the cognitive, sensory and the kinesthetic element. So, and it also taps into the affective component. So somewhere it engages, it helps an individual to engage in different parts of the brain. So even from the neuroscience perspective, it helps a person to shift from flight and fight mode towards rest and recharge mode. So this helps to release the stuck emotions that are suppressed, not tapped into, and there is no in trauma, I think it's very difficult to verbalize.
That's very interesting. Also, do you feel that when you suggest art therapy, or when you've been using it in your experience, has it made it easier for you to connect with the patient who initially is not very open to share? Because whenever we even suggest that a patient with a rheumatological disease meet a psychologist, because our intentions are that you have to live well with a chronic illness, not just live with a chronic illness, right? So whenever we suggest there's that immediate barrier that they feel, nothing's wrong with my brain, why should I go see a psychologist, I'm fine. So does art therapy help you break that barrier to some extent once they reach you?
Yeah, definitely. I think they find it interesting also, where they are curious to explore. It brings in that curiosity. They are creating something.
Yes.
And they have a tangible thing in front of them, wherein it helps to create that distance. So, for example, if you take pain, so giving a voice for that pain by helping them create art for the pain, how they feel. So they do create like different forms or different symbols or metaphors, and they try to make meaning out of their own experiences. So by giving voice and creating a narrative between the pain and an individual, it helps them to stay with that. And it also creates safety without being too overwhelmed, like how it happens in the talk therapy most of the times. And also it helps them to connect to their bodily sensation. So this we call it as felt sense, wherein they are connecting to the felt sense, staying with that, and then expanding the capacity to hold what is coming up. So this acts as a containment to hold the emotions.
That's very interesting. How frequently do you follow these patients up? And how long do you think on an average? I mean, I'm sure for each patient it's different and how they respond is different. But once you follow them up, how long do you think they take to feel better with art therapy, with whatever your ways of assessing them are? But what is the usual duration that you see the patient?
So it usually, like they do need like 8 to 12 weeks to respond and to understand. It needs little bit of time and investing in themselves. So it can I usually integrate art therapy with CBT and then art therapy with mindfulness. So these different approaches, integrating approaches, helps them to make meaning out of their experiences. So yeah, I think most of the times they continue, but sometimes it can be quite exhausting also, because all therapy sessions are not very happy sessions. Sometimes they need the bandwidth to hold. So integrating trauma informed care with art therapy helps them to create that safety, and it is up to them to come back when they have space. And they do come back if you offer that safety.